The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Thanks for joining us today. And today we're going to focus on anxiety. And anxiety is often overlooked as a feature in autism spectrum disorders. It's not part of the diagnostic criteria, and it's often not thought of as a core feature of autism spectrum disorders. But today we're going to see that anxiety disorders, anxiety conditions are common in autism, and that they should be seen as symptoms of underlying disturbances. We're also going to see that the current explanatory model for anxiety disorders is lacking, and that model is focused on imbalances in serotonin and other neurotransmitters, and that there's a need for a more complex, individualized, and holistic model, both to better understand anxiety and address it. So how do children manifest anxiety? And this is important because if we focus only on how adults manifest anxiety, we may overlook cases. So most of us have an understanding of how an adult would manifest anxiety. They may talk about things they're worried about. They may describe muscle tension. They may describe difficulty sleeping. They may seem restless. But what about a child, and especially a child who may not have the language to describe thoughts of worry and anxiety? How would they manifest anxiety? And the symptoms may look like a temper tantrum, meltdowns, being inflexible, getting stuck on topics, doing the same things over and over again as a way of self-soothing. They may also have problems separating from their mother or another caregiver and other clinging behaviors, crying, being hyperactive. So we can see that anxiety can present as a host of symptoms that may not, at first glance, look like anxiety. And there are also physical signs of anxiety that most people have experienced at some point. But again, with children with autism, they may not have the language to describe these symptoms. So what causes anxiety? So anxiety occurs when there's a stress that exceeds the body's ability to cope. Traditionally, when we think about causes of anxiety, we think about emotional contributors, such as emotional abuse and neglect. And while these could cause anxiety, these aren't the issues that I see in the children that I see in my practice, or that I think are the primary issues in children with autism. So what are other things that can cause stress, and stress specifically at the biochemical level or the cellular level? And there are a host of things that can cause anxiety or stress that we may not think of. And these include chemical toxins, heavy metals, nutritional deficiencies, infections, especially chronic infections, pain, and perhaps even electromagnetic fields. There's some research coming about how that can be stressful for some children too. Excess temperature changes, loud noises, and physical trauma. So how common are anxiety disorders in children on the spectrum? This one study focused on children with PDD. They looked at the rates of anxiety, and they found that 43% of the children met the criteria for at least one anxiety disorder. And what they found is that the children who had higher IQ and better functional language were more likely to have anxiety. Now, is that likely? It is possible, but the other possibility is that the children who didn't have as much functional language didn't present anxiety in the way that we think of as anxiety. So they may have had the temper tantrums. They may have had the meltdowns. And those were overlooked as symptoms of anxiety. So the true rates may be higher than 43%. In a larger study, this is a meta-analysis looking at 31 studies involving over 2,000 young people with autism, they found again that about 40% of children with autism have at least one anxiety disorder. And again, the rates may be higher if we look at all the ways that anxiety may present. There are also studies that show that the relatives of children with autism are more prone to anxiety disorders. So now that we've established that anxiety disorders are not uncommon in autism spectrum disorders, we're also going to look at new ways of understanding anxiety and addressing it. So first we're going to look at anxiety, obsessions, and compulsion as symptoms. So they're symptoms in the same way that a fever is a symptom. A fever is not a disease. It's an indicator of a disease. And we need to do further testing to find out what's going on underneath. The same with anxiety. And then I'm going to argue that to really understand anxiety, we have to go beyond serotonin disturbances. which is what we focus on now, serotonin, epinephrine, and dopamine. We need to look at other substances in the brain, including glutamate, inflammation, and brain-derived neurotropic factor. But we need to go beyond the brain to really understand anxiety and look at the whole body. We need to look at the autonomic nervous system, the endocrine system, the mitochondria, the GI system, and even the immune system. So what are the most common ways of addressing anxiety at the moment in children with autism? And not surprisingly, these are psychotropic drugs, the most common being antidepressants, such as the SSRIs, which include Celexa, Zoloft, and Prozac. So how do these drugs work? These drugs work at the synapse. That's a space in between two neurons in the brain. The synapse in that space is where neurotransmitters such as serotonin are released. The thought is anxiety is caused by low levels of serotonin. So these drugs allow the serotonin to stay in the synapse for longer periods so that it's more active. The problem with this model is that more and more studies are showing that these drugs are not as effective as we thought. So these drugs were originally developed for depression. And when we look at studies, there are many studies showing that these drugs help depression. However, these are just the published studies. There are many unpublished studies that were conducted that the results for which are negative. So when you take all the published studies and the unpublished studies, these drugs look far less effective than we previously thought. Focusing on children with autism, the largest study of an SSRI looked at citalopram or Celexa in children with autism and how it helped repetitive behaviors. What they found was that the citalopram was significantly more likely to be associated with adverse effects, but it didn't help the repetitive behaviors. The other concern is that these antidepressants can increase the rate of behavioral symptoms, of new adverse psychiatric effects in children. Specifically, the SSRIs seem to be linked with something called activation, which includes symptoms of insomnia, arousal, irritability, and anger, and then also mania or hypomania, which is a further degree of activation. Children with anxiety who are put on SSRIs have activation rates about 12%, and then children with depression have hypomania, mania rates of about 10%. So these aren't uncommon adverse effects. There's also a black box warning on the use of SSRIs in children in that it may increase the rate of suicidal ideation. So again, these medications are far less effective than we previously thought, and they are associated with side effects, which are not insignificant. The side effect that concerns me the most as a psychiatrist is what happens to the developing brain when SSRI medications are used. And we have almost no studies that look at this question. So if a child's brain is developing and they're on long-term SSRI brains, what happens to them when they're an adolescent? What happens to them when they're an adult? And again, we don't have these studies because most of the studies looking at adverse effects only focus on what happens after 6 to 8 weeks, immediate side effects. There was one study looking in mice at what happens when SSRI medications are used early in life, what happens later in life when the rats are adults. And concerningly, they found that the rats, when they're adults, had increased rates of anxiety and decreased serotonin. So again, we can't extrapolate from an animal study and conclude this happens in children and humans, but this is a concerning study, and what's more concerning is that we don't have the data to know that these drugs are safe to use long-term in children. So looking at all the psychotropic medications that are used in children with autism, there's only evidence for efficacy in the antipsychotic drugs, in the newer antipsychotic drugs, risperidone and aripiprazole, or Abilify. However, these drugs have very serious adverse effects, including metabolic syndrome, which can lead to diabetes, weight gain, and also movement disorders, which in some cases can be irreversible. So they're certainly not first-line medications, and we want to look at interventions that are safer and better tolerated. So now that I pointed out that the serotonin hypothesis may not be sufficient for understanding anxiety, I do want to say that serotonin disturbances may be part of the picture. So they may be part of the picture for some children, but even in those children, it's unlikely they're the whole model or the whole explanation. But again, what causes the serotonin disturbances? Why is it there? And there may be a number of issues. One thing that we're looking at now, both in autism and in psychiatric field in general, is problems with methylation. And methylation includes the folic acid cycle and the methionine cycle with methyl B12. And these cycles are linked with the cycles that lead to production of neurotransmitters. So it may be children who can't recycle methyl B12 or folate, the active form of folate, have disturbances in serotonin. And supporting these cycles with methylation support may help. Another cause for lower levels of serotonin may be activation of an enzyme called IDO. So serotonin is made from an amino acid called tryptophan, which is in the middle of the slide that you can see. So tryptophan is the amino acid that's in high rates of turkey, and that's why people often feel sleepy after they've eaten turkey, because tryptophan gets converted to serotonin. But there's an enzyme called IDO, which, if it's upregulated, can take tryptophan and rather than making serotonin, make these other metabolites called quinurinic acid and quinolonic acid. So what causes activation of the IDO enzyme? Inflammation and also infections, and these include chronic infections such as parasites, viruses, strep, and Lyme disease. So an infection may cause this disturbance and low levels of serotonin. Prozac may help that serotonin hang out longer in the synapse, but it's not going to address the inflammation, and it's not going to address the infection. And we want to get to the root cause to have a greater degree of healing for the child. Cortisol, which is released when they're stressed, can also lead to depletion of serotonin and increases rates of quinolonic and quinurinic acid. So this is a complicated slide. You can see the IDO enzyme in the red box in the middle of the slide, and you can see how it depletes tryptophan, but it also leads to these other substances called quinurinic and quinolonic acid. And these metabolites are not benign. They have an action, and they act at the NMDA receptor. And at this receptor, they can, if they're activated to large degrees, lead to further inflammation. And that also needs to be addressed. To further complicate matters and to see how complex the issue truly is, we have this slide. So if you look at the top of the slide, you can see in a green oval the tryptophan. And you can, but there's much, much more going on. So the tryptophan can lead to the quinolonic acid. But you can also see that all of this is also connected to cortisol, which is produced by the adrenals, which is in the body, and the whole body and inflammation. So we need to look at the whole body and many organ systems and many metabolites to really understand what's going on in chronic anxiety disorders. So now we're going to move beyond the brain, and we're going to look at the peripheral nervous system. So the peripheral nervous system is just that part of the nervous system that's outside the brain, and includes a part of the nervous system called the autonomic nervous system. The autonomic nervous system does all those things that you're not thinking about. So you're not thinking about how fast you're breathing, likely at this moment. You're not thinking about your temperature, regulating your temperature. You're not thinking about how much you're sweating. These things are done automatically by the autonomic nervous system. There are two parts of the autonomic nervous system. There's the parasympathetic and there's the sympathetic. The parasympathetic is involved in rest and digestion. This is what you need when you're healing, sleeping, digesting food. There's another part of the nervous system called the sympathetic nervous system. This is what is commonly known as the fight or flight part of the nervous system. It gets activated when there's danger or the sense of danger. So historically this would happen if we were, for example, if there was a hunter-gatherer in the wild and there was a predator. You would need the sympathetic nervous system to kick in, and you would have blood go to the big muscles in the body so the person could run away. The pupils would dilate so you could see for a far distance. The heart rate would go up. And this is very adaptive, and it would save the person. What's been found in autism spectrum disorders is that there's a dysregulation in the autonomic nervous system. And there are two disturbances. Specifically one, the children tend to be in the sympathetic mode to a higher degree and for greater periods of time. So they're sensing danger even when there isn't danger. The other thing that they found in some children with autism is there's significantly less flexibility in the autonomic nervous system. So it's important for the sympathetic nervous system to be flexible because we change all the time. So you may go from being in the hot outdoors to coming inside in a building where there's air conditioning. And that's not stressful necessarily. You're able to adapt. Your body's able to adapt. You can go from being outside where there's lots of light to going indoors where there's less light. Again, your pupils adapt. But what they found with children with autism is that this flexibility isn't always there. So they're less able to adapt. Well, what does this look like? Many of the children with autism are noted for having less flexibility in their behavior. They get stuck. They need to do the same things over and over again. If they're taken from one setting to another, they have a meltdown or a temper tantrum, and we think they're just being difficult, for example. But it may be that their autonomic nervous system just can't keep up. There's a study done in 2011 that looked at the sympathetic nervous system and how a treatment that addresses the sympathetic nervous system might help language. So they used propranolol, which is a beta blocker, and it reduces sympathetic drive. And they found that children who had high-functioning autism and were given propranolol had better speech fluency. So they just spoke in a more fluent way. And this isn't surprising because propranolol is often used when people are giving a lecture and they feel jittery. It helps them be more fluid. So we can see how addressing anxiety through the nervous system can help language, which is a core feature of autism. Essential oils also can have an effect on the sympathetic nervous system and the parasympathetic nervous system. Now we're going to look at another part of the body, and this is the hypothalamus pituitary adrenal axis, or what's known in shorthand as the HPA axis. This is how the brain and the body recognize stress and respond to it. So part of the brain called the hypothalamus, when it senses stress, speaks to the pituitary, which releases something called ACTH, which speaks to the adrenal glands. The adrenal glands are little glands on top of each of the kidneys. The adrenal glands, in response, produce hormones including cortisol. So this axis develops early in life in response to the environment, which includes early trauma and neglect. And this has been studied, for example, in sexual abuse, in early neglect. And that can shape how this axis works. So later in life, someone who experienced stress early in life may have higher levels of cortisol or lower levels of cortisol, depending on programming. This disruption in cortisol often is overlooked by physicians because they rely solely on blood levels of cortisol. Blood levels of cortisol are only affected if there's a high degree of destruction of the adrenal glands, about 90% or more. And we don't see that in states of anxiety or autism. We see more subtle dysregulations that, even though they're subtle, are significant in terms of behaviors, we believe. So these type of disturbances can be picked up in saliva cortisol. And saliva cortisol has been recognized as a valid biomarker of stress in psychiatric research settings. So for example, in this study, they looked at children with autism and then also healthy children and how these children responded to the stressor of a blood draw. So on the bottom, you have healthy children. And you can see they had a slight increase in cortisol after they had a blood draw, but they came back to baseline soon after. Higher up, you have children with autism. At the very top, you have girls with autism. And you can see they had a higher degree of cortisol release. They don't come back to baseline quickly. They stay high up. So they may experience the same stressor to a larger degree and not come back to baseline. And we often hear this. The parents talk about how their child has a stress and they just can't get them back. It's 20, 30 minutes later. And once the child is stressed, they can't get them easily back. And this is one physiological explanation. This is another study looking at saliva cortisol in children. And in this study, they looked at the stressor of interacting with other children. This is more of a more complex slide, but what you can see is in the red lines are the children with autism. The solid line is older children, and the younger children is the dashed line, and the blue is control. So you can see that the older children with autism had higher levels of cortisol, and the younger children with autism had lower levels. So this dysregulation can either be a higher release or a lower release. It's just what's common is that there's often dysregulation. There's also a diurnal rhythm in cortisol release. What that means is that our cortisol levels are highest in the morning. That helps us get out of bed. That gives us energy. And then the cortisol levels slowly fall during the day, and in the evenings, they're very low so that we can wind down and go to sleep. And you can see this nice pattern on the right. These are typical children. And you can see this peak. The high levels are in the morning, early morning, and the low levels in the evening. On the left, you see a very scattered picture, a very scattered diagram. And you can see that the cortisol levels are all over the place. Some of the children fall in nicely, but then there are other children that have patterns where they're higher levels at night, lower levels in the morning. What could that look like? So low levels of cortisol in the morning can look like difficulty getting out of bed, fatigue, low stamina, difficulty coping. Higher levels of cortisol at night can look like a child who can't wind down, can't get to bed, who may have difficulty staying asleep. So what causes this disruption in cortisol? So we saw that early life stressors, including emotional neglect and trauma, can impact how this HPA axis develops. There's also evidence that chemical toxins, certain chemical toxins, may affect the development of the adrenal glands. So there are many, many chemicals that children are exposed to, and pregnant women, that are endocrine disruptors. And these endocrine disruptors may act not just on the thyroid gland, but also on the adrenal gland. And then there's also secondary effects. So if other parts of the body are under stress, that may also cause this programming of the HPA axis early in life when there is a dysregulation in cortisol release. One thing that's been studied for coping with high levels of cortisol, inappropriate high levels of cortisol, is phosphatidylserine. This is a fat complex. And it's found that phosphatidylserine, when given as a supplement, can help with high levels of ACTH and cortisol, and also help with feeling physiologically and emotionally overwhelmed. Many of the phosphatidylserine complexes, including the one that was used in the study, are made from soy, and we know that many of the children that we work with are sensitive to soy. So there are also now products that are available made from sunflower lecithin. Now we're going to switch gears and talk about the gut-brain axis. And this has gotten a lot of attention recently, and we know that there's a strong link between what's going on in the GI tract and the brain. And this isn't surprising because the GI system contains about 100 million neurons, more than the spinal cord or the peripheral nervous system. And many people don't know this, but 95% of the serotonin in the body is in the gut, not in the brain, in the gut. And there's a gut-brain axis. So this simply means that the gut and the brain talk and communicate, and it's bidirectional. So the brain can speak to the gut, and if something's going on in the gut, that can impact the brain. It goes in both directions. And the microbiota, these are all the living organisms in the gut, including bacteria, viruses, parasites, and different fungi. They can also affect brain development and behavior, and what's going on and perceived in the brain can impact the development of the gut microbiota. So how does stress affect the gut? In an animal study looking at young rats that were separated from their mothers, they found that the lining of the gut in these rats became weakened and more permeable, what we call a leaky gut. There are also a number of psychiatrists, including Dr. Emran at UCLA, who found that many of the patients that they see with chronic GI disorders have a history of early childhood trauma, and that many of their patients with anxiety and trauma and depression have GI disturbances. So there's a strong link. In animal studies, they've also found a strong link between early life stress and the microbiota. For example, in this one study, they found that prenatal stress could impact the bacterial colonization. And exposure to stress in mice reduces the number and diversity of the microbial population and leads to overdevelopment of certain bacteria that shouldn't be there in large numbers, such as the citrobacteria. So this begs the question, can probiotic, the good bacteria, be used as psychotropics? And there's just very early studies in emerging literature showing that there may be a beneficial effect of oral probiotics on mood and anxiety symptoms. So there's, again, early studies. One of the problems, though, is that the probiotics we use are very limited in that they have maybe 10, 11 different strains of good gut bacteria, when in reality there are hundreds, even maybe 1,000 of different species in the gut. And the most common species often are not reflected in the probiotics. In this one study looking at mice that were fed lactobacillus. So lactobacillus is a good bacteria that's found in many probiotics. It's also found in yogurts. They found that the mice that were given the lactobacillus had activation of the GABA receptor. And GABA receptor is a major calming or inhibitory receptor neurotransmitter in the brain. And that's where alcohol and drugs such as Valium and Klonopin work. And there are also studies showing that chronic GI inflammation can induce anxiety-like behavior in mice. So again, inflammation in the gut can cause behavioral changes that look like anxiety in mice. So this is, again, another schematic or diagram of the gut-brain connection. And you can see that it's bidirectional. The arrows go in both directions, from the brain down to the gut, and from the gut towards the brain. And the microbiota are also involved. And it's a very complex system with many things involved, including, we're going to see cortisol, tryptophan, which is a neurotransmitter, cytokines, and neurotransmitters. Now we're going to switch gears again and talk about possible infectious causes of anxiety. And this may seem like a strange statement at first. Infectious causes of anxiety? Anxiety and infections are two separate issues. However, there's now again emerging literature on how certain chronic infections especially can lead to states of anxiety and other psychiatric symptoms. And these infections we think include Bartonella, Borrelia, which is the bacteria causing Lyme disease, strep, especially in syndromes called PANDAS, and then also what we're going to look at PANS and PITTANS, and parasites, including toxoplasmosis. Now what's challenging is that in autism, these infections are often chronic and difficult to diagnose. And they're difficult to diagnose for a few reasons. One, conventional testing may miss many of these infections, especially infections such as chronic Lyme disease. And also the symptoms may not look like an infection. The symptoms may be primarily anxiety or low stamina and not high fevers, a cough, what we think of as the typical symptoms of an infection. So now we're going to look at PANDAS. And this slide should be also PANS, P-A-N-S, to reflect more recent understanding of these disorders. So PANDAS is the more, we'll start with PANDAS because that was first described. So PANDAS is the pediatric autoimmune neuropsychiatric disorder associated with strep. What happens to these children is that after exposure to strep or strep infection, they have usually the sudden onset of psychiatric symptoms. Classically, these are repetitive symptoms, OCD, separation anxiety, and tics. And the treatments often are reduction of the load of strep with antibiotics or antimicrobial herbs, as well as treatments that address the immune disturbances in these children. So what happens to these children is that after they're exposed to strep, they have an immune dysregulation, including perhaps autoimmunity, where the body starts attacking itself, and that results in psychiatric symptoms. So I commented that we should be calling this PANS now, P-A-N-S. And that reflects our newer understanding that, and actually this is not a new understanding, this was first recognized, but that's come into the common language more so, that these acute changes, acute onset of psychiatric syndromes after an infection, it happens not only after strep, but a number of infections, including viruses, parasites, Lyme disease. And that the treatments, again, are looking at addressing microbial infection and also addressing immune disturbances. So the treatments would not be primarily Prozac or Zoloft. These children may respond to that, but the ideal treatment would be treating the underlying immune disturbance and infection. Lyme disease. So Lyme disease, which is caused by the bacteria Borrelia burgdorferi, is another infection that's known to, in later stages, impact the brain and cause not only anxiety, but really any psychiatric symptom. What's challenging in Lyme disease is that the early symptoms often are non-specific. So the specific symptoms of Lyme disease include an EM rash, which is a bullseye rash, after a tick bite. So if that happens to somebody, they often get diagnosed with Lyme disease, they get early treatment, and they don't develop the later stages. But in some patients, it seems that they don't get the rash, they don't recall a tick bite, and the symptoms may be vague, such as chills, fever, fatigue. But this bacteria can then be dormant for many years, and later on, many months to years later, present with psychiatric symptoms, which are then diagnosed as a primarily psychiatric disease or disorder. So parasites. Parasites are another class of microbes that seem to have the potential to affect the brain and change behavior. One of the most common parasites is toxoplasmosis. This infection is found, for example, antibodies to toxoplasmosis are much more likely to be found in patients with OCD than in healthy controls. We're now going to switch gears and talk about something called the mitochondria. And the mitochondria have gotten attention recently in children with autism because it's found that children with autism have the tendency towards mitochondrial dysfunction. And another finding is that mitochondrial dysfunction can be linked to anxiety. And many of the drugs that we use in psychiatry can further mitochondrial dysfunction. This includes Depakote and typical and atypical antipsychotics, including risperidone and Abilify, can further mitochondrial dysfunction. Now we're going to talk about certain minerals and fats and nutrients that can be involved in anxiety. The most important one, I believe, is magnesium. In animal models, they found, specifically in mouse models, they found that disturbances in magnesium levels both in the plasma and the brain are significantly correlated with anxiety behaviors. Magnesium acts at both the NMDA receptor and the GABA receptor. The NMDA receptor is an excitatory receptor. Magnesium can calm that receptor, and the magnesium also has a beneficial effect or positive effect at the GABA receptor, which is involved in calming and reducing anxiety. Zinc deficiency has also been associated now with the potential for being linked with anxiety disorders. So there's a growing body of literature supporting the association between zinc deficiencies or low levels of zinc and ADHD, poor appetite, depression, and anxiety. Zinc is involved in the production of neurotransmitters, including serotonin and glutamate. It's also involved in the body's ability to cope with oxidative stress. They found that animals that have zinc deficiencies are more likely to be anxious, and that rats given a zinc deficient diet were shown to have higher levels of cortisone or cortisol release after being exposed to stress. Chromium is another mineral that's really important in blood sugar regulation and then secondary linked to anxiety. So chromium is linked to how the body regulates blood sugar. And the thought is that if there's low levels of chromium, there may be dips in blood sugar, and these dips in blood sugar may lead to secondary periods of anxiety, irritability, and fatigue. And some people have experienced this. They know that if they skip a meal, if they don't have a snack, they're going to feel really irritable, anxious, tired, and they have to eat. They have to get something with sugar. Chromium may help regulate that. In one study looking at patients who had atypical depression, and atypical depression is associated with changes in mood throughout the day or mood lability and also carbohydrate cravings, they found that the chromium supplementation helped with the carbohydrate cravings and the mood changes. B6 is another vitamin that's been associated with production of neurotransmitters, and that may also help with sympathetic drive, reducing it. Fats, so omega-3s, have gotten a lot of attention recently. In this one small study looking at medical students who were given fish oils, they found that the fish oils led to a decrease in LPS, which is a marker of inflammation, and also a reduction in anxiety symptoms. So this data suggests that omega-3 fish oils can reduce inflammation and anxiety even among healthy young adults. So the omega-3, the absolute amount of omega-3 is important, but the ratio is probably even more important. So the ratio between omega-6 and omega-3 is one of the indicators of inflammation in the body. So we evolved, it believes, to have a ratio of omega-6 to omega-3 of 1:1. But in the modern Western diet, the ratio is closer to 15:1. So it's heavily towards omega-6, and this can lead to inflammation. One of the contributors towards high levels of omega-6 is the high levels of vegetable oils that were used. And this is because we were all told to be worried about having saturated fats and butter and heart disease. So people started using things such as corn, sunflower, and safflower oil, and also soy oil. And these are very high in omega-6s. So for example, corn oil has an omega-6 to omega-3 ratio of almost 49:1. Very, very high in omega-6. So now we're going to look at treatments for anxiety disorders. And before we look at specific treatments, I want to propose a new model at treating or addressing anxiety. And again, remember, the original model, the current model, is serotonin disturbances. And I'm going to argue a better model for understanding how to understand and address anxiety, and this is also true of depression, is neurogenesis. So neurogenesis is the birth of new neurons in the brain. And it's the failure of neurogenesis that can lead to anxiety and depression. So treatments that promote neurogenesis may help with anxiety disorders. SSRI medications, which seem to work to some degree in anxiety and depression, promote neurogenesis, we found. What's significant is the SSRI medications help with serotonin disturbances within hours. But these drugs don't help anxiety and depression for many weeks. Most psychiatrists tell their patients that these drugs may not work for a month, 4 to 6 weeks. So what happens in the interim? Because that serotonin disturbance was addressed early on. It seems that it takes about 4 to 6 weeks for the neurogenesis to kick in. There are other things that can help with neurogenesis, and this includes exercise, Rhodiola rosea, which is an herb, and we're going to look at that specifically in more detail, and even an enriched environment, which simply means an environment that's stimulating and allows one to learn and be challenged. All of these enhance neurogenesis, and having this holistic model that supports neurogenesis may be the best model for understanding and addressing anxiety. So the idea of neurogenesis is really a revolution in thinking in brain science. For many of us who are physicians now, when we went to medical school, we were taught that the brain just had a certain number of neurons, and if you had a brain disorder, especially something like stroke, you were out of luck because the brain didn't heal. And again, with autism, that's a brain disorder. We were taught that there wasn't much hope. But now we're finding that there's much more adaptability, and the brain is much more plastic than we thought. So there's more hope for some of these disorders than previously thought. And this is an excellent book. It's called A Brain That Changes Itself. And this is a complicated schematic of many things that are involved in neurogenesis. So again, let's look at new approaches to treating anxiety. First, we're going to look at anxiety as a symptom, in the same way that if your child had a fever, you would look at that only as a symptom, not as a disorder, recognizing that there are many possible things that could be going on underneath. Could be an infection, could be something going on in the GI tract, could be mitochondrial dysfunction. And you shouldn't be content until you figure out as much as possible what's going on underneath. And often we're not able to figure out all the things, but we should make an effort to determine as much as we can about what's going on underlying. And that the treatment should be individualized. No two children are going to have the same identical underlying contributors. Often there are multiple systems at work. We saw some of the schematics looking even at serotonin and how that's connected with kynurenic acid, the NMDA receptor, inflammation, cortisol. So there are usually multiple systems involved when there's anxiety. And the ideal treatments, the best treatments, address more than one system simultaneously for optimal improvement. And you want to also reduce stress in the patient's life when you're working on these treatments. And then we'll talk about this at the end, treating the family as a system whenever possible, especially because children don't exist in isolation. They only exist as part of a family system. So the first group of herbs we're going to look at are herbs that are known as adaptogenic herbs. These are herbs that have been used in traditional healing systems such as Chinese medical system, Ayurvedic medical system for centuries. And they were used after someone had had a period of stress or before they were expected to have a period of stress. And they were thought to help the body cope. And these periods of stress could be infections, could be trauma, injury. And the adaptogenic herbs are plant derivatives. They're not simple compounds such as magnesium or fish oil. Because they're plant derivatives, they're complex. They have many, many different active compounds, and they worked on many systems. So remember, we think anxiety is due to many types of disturbances. It's a complex disorder, complex causes. So we want a treatment that has a similar level of complexity, which includes adaptogenic herbs. The adaptogenic herbs may modulate the immune system, the antioxidant system, the hormonal system, and the nervous system. And on the next two slides, including this one, I'm going to show you a list of adaptogenic herbs. It includes suma, rhodiola, rosea, astragalus, tulsi or holy basil, chandra, ashwagandha, licorice, ginsengs, and maca. if you take any one of these herbs and put them into PubMed, that's P-U-B, Med, M-E-D, and PubMed is a listing of all the literature, medical literature on various topics. For any one of these herbs, you're going to find numerous studies. And there's much evidence for the efficacy of many of these herbs. A lot of the studies were done out of this country, and many of the studies are still just animal studies, but there's a lot of evidence that these herbs have a biological effect. So for example, looking at just some studies on rhodiola and rosea, in rats exposed to the stress of cold and hypoxia, they found that rhodiola was protective. It increased glutathione, and it helped maintain the cell membrane permeability, which is important for letting toxins come out and nutrients come in. In rats that were depressed, a depressive model of in rats, they found that rhodiola rosea helped serotonin levels in the hippocampus, and it induced neurogenesis. It induced neural stem cell proliferation. And this is an herb that is fairly well tolerated and not that expensive. And you can see how powerful it can be, especially powerful when you use it in conjunction with other things, such as magnesium, such as that enriched environment. Nervine herbs. So these are herbs that are thought to have a calming effect on the brain. And if you start looking at this list, you may recognize many of these lists because these are often in calming teas. So if you have teas that are used for sedating, for calming, or for getting to sleep, you'll often find a combination of these herbs, such as chamomile, lavender, passion flower. And they can also be used in tinctures and the whole herbs for calming effect on child, especially if their anxiety presents as hyperactivity and difficulty sleeping. So here's another summary of some vitamins, fats, and minerals that can be helpful in anxiety. I've gone through most of these. So for example, vitamin B is involved in neurotransmitter production. It can help with stress. Folic acid, 5-methyltetrahydrofolate, helps with the folic acid cycle, which may help with neurotransmitter production. Same with B12. Pantothenic acid is important in the mitochondria. Vitamin C is also important in inflammation. Tyrosine you need to make neurotransmitters such as dopamine and norepinephrine. Tryptophan you need to make serotonin. L-theanine is a calming amino acid. 5-HTP can be used to make serotonin. Lecithin is a source of this. Phosphatidylserine, magnesium, zinc, and chromium are all minerals that we discussed. And then the last one is sea salt or Himalayan salt, a healthy salt. And why is that important? Well, it's found that when you have prolonged periods of stress, you may waste salt. And this is through something called aldosterone. And I see some children who have salt cravings. And when we measure their salt in the body, in the blood it's often fine, but if we measure 24-hour urine salt, it's often low. And these children report sometimes feeling dizzy or lightheaded because you need not just water to maintain blood pressure, but you also need adequate levels of salt. So for these children, having enough salt in the diet and bringing up the urine sodium can really help and make them feel less anxious and stressed. Mitochondrial cocktail. So addressing mitochondrial dysfunction seems to work best when you use a number of different minerals, herbs, and vitamins that seem to support the mitochondria. And here's a list of some things that are known to help with mitochondrial function, including antioxidant coenzyme Q10, riboflavin B2, niacin B3, thiamine, biotin, pantothenic acid, which is B5, L-carnitine, which shuttles fats into the mitochondria, creatine monohydrate, alpha-lipoic acid, another antioxidant, D-ribose, a sugar that supports ATP production, selenium, vitamin E, and vitamin C. So in summary, anxiety, it's not all in your head. So we think of anxiety as something that's in the head, but it's really a whole body condition. And to really understand and address anxiety, we need to assess and address mitochondrial dysfunction, possible infections, hormonal imbalances, gastrointestinal disturbances, oxidative stress, and even looking at toxins because those can cause stress to the system at the cellular level, at the biochemical level, at the nervous system, and then also fatty acid imbalances. So it's complicated. And then to really best address these disturbances, I feel that a holistic model is much better than just using a single drug. So a holistic model looks not just at supplements, which I've talked about, or vitamins, but the whole child. So it looks at, are they spending enough time in nature and grounding? Spending time in nature has been found in studies to reduce stress, reduce cortisol. Light treatments, are they getting enough of the blue light early in the day? Mindfulness, breathing, body work. Is their body under stress because they have misalignments? Are they getting enough of the good type of movement that they need? Psychotherapy, so for children who are verbal, adults, if they've had trauma, especially if they've had trauma, but even otherwise, having talk therapy can be very helpful. Having the support of a person who cares and helps them understand their experiences can help. If they're open to spirituality and prayer, that can also help. And then homeopathic or energetic treatments. And then the last issue, again, is treating the whole family. Recall there was that earlier slide that showed that family members of children with autism are more likely to have anxiety. And this can both be because they're coping with a chronic illness, but it's also thought to be that they have genetic vulnerabilities that make them more prone to anxiety disorders. And they share similar genetics, environmental exposures, and diets, which may all lead to a higher rate of anxiety disorders. But also consider the stress of caring for a child with chronic medical and behavioral issues, as well as a lack of validation by the conventional medical community of autism as a whole body-based and biomedical condition for which there's hope. And lastly, just consider PTSD in parents. So for some of the mothers I work with, they can recall that when they were first told that their child has autism and they were told that there was no hope, the child was going to be institutionalized. And even if the child is doing much better and is improving and healing, they still have trauma from that moment. So finding out how has the diagnosis affected, how is living with this child affect them, and if there are signs of trauma, helping the mother or both parents. I say mother because often it's the mother that comes in, but it can also be the father and other family members, helping them get the support and help they need. So thank you again for participating today and taking the time to listen to this topic.
Okay, so now we're going to go through some of the questions. We got a lot of questions. The first question, my 15-year-old has developed a tic in the last year. Could that be due to anxiety?
So that's an interesting question. Tics often are worsened if there is anxiety. So some of the children I see, they'll have tics more so under periods of stress. But I think more importantly, the underlying issues of both anxiety and the tic can be similar. So all the issues that I've talked about today could be at play. If there's a sudden onset of tics, then it may be associated with the PANS or PANDAS type syndrome that we also discussed previously.
Okay, this is a parent who has a son who is 8 years old. He has autism and severe anxiety. He's not been able to take SSRI medications because it has a disinhibiting effect on him, which leads to hitting, aggression, compulsive swearing. We're desperate for support that will help him with the anxiety without causing aggression. Do you have suggestions?
Well, I can't give specific suggestions for any child that I haven't met and that I'm not treating. There are two things I can say about this case. One, it's not uncommon to have whether you call it disinhibition or activation in the setting of SSRIs. You can see the study that was mentioned here, so almost as much as 10 to 12% of children may experience some degree of this. Many of the treatments that I mentioned in the study can have a calming effect and don't seem to have the tendency towards the activation. This includes things like magnesium, and that's generally safe, but again, I wouldn't recommend using anything unless it's under the supervision of a licensed healthcare practitioner, whether it's a naturopath, a nurse practitioner, or a medical doctor. But the magnesium, rarely I've seen, has any adverse effect. Anything has the potential, especially for children who are sensitive. Many of the herbs that I mentioned also have very calming effects and don't seem linked to activation, and this includes the Rhodiola, maca, Chandra, the nervine herbs. So the good news is there's a lot of potential treatments out there that I think are warranted and would be worth trying in the child, but I would suggest finding a healthcare practitioner who's versed in these approaches to help you.
Okay, the next one, this person's asking, could you please talk more about how essential oils affect autonomic nervous system and can help with anxiety, and applications of essential oils, oral or topical, or use of aromatherapy?
Okay, so that's a big topic, but I'll just touch on it slightly. What they found is in certain studies, certain oils, including lavender, rosemary, those are the two that were mentioned there, what they seem to do is they seem to increase acetylcholinergic activity, which activates the parasympathetic nervous system, and that's the calming part of the nervous system. And these oils can be used in many different ways, and I'm not going to be able to address all of them because they depend on the oil. So certain oils can be taken safely orally. Some of them can only be used topically. Some oils, when they're used topically, have to be diluted. They can't be put directly on the skin. So lavender oil is one that I commonly use, and it can be put on the skin. And we often have parents rub it on the skin at night to help, or put a couple drops in the bathtub, especially if they're doing something like Epsom salt bath. They can also be diffused, and this is diffusing is very nice because the nose, when there is connected directly, it's one of the few nerves that's connected directly to the brain. So there's a direct effect, and so when you're smelling these, you have an effect that's calming on the brain. So diffusing, you can get a diffuser that heats up these oils gently, and then the child smells it. And this is especially nice if they don't want to be touched or they don't want the oil on their skin.
Can you talk a little bit about testing for chronic gut microbiota problems? Are there conventional testing methods that usually work, or are there tests that are more effective?
That's a great question. So for a conventional doctor, if you went to a typical psychiatrist or pediatrician, they wouldn't do any testing for these issues. Regular stool cultures don't measure out the good bacteria, and that's what we're primarily concerned with, the good bacteria, parasites, and yeast. In the Autism Research Institute community, many of the doctors who are involved in this approach with the biomedical approach use stool cultures looking at the good bacteria. And there are a number of labs that do this, including Genova, Metametrics, and Doctor's Data. And I often use this as a baseline in patients if they have any GI history. And it gives you a rough sense of what's going on in the gut. So you may find that they have almost no levels of lactobacillus and no levels of bifido. And they also have a history of prolonged antibiotic use. And then they have overgrowth of different bacteria. So this can be helpful in suggesting disturbances in the microbiota, but one thing we have to be careful of is we don't have great testing at the moment. We don't have tests that look at all of the species of the microbiota. I mentioned they're probably closer to 1,000. And the most important species, the most abundant, we don't have tests for. So I think we always have to keep that in mind. And you may do a test on a child and everything looks good, but they have a history of GI symptoms of antibiotic use. So something may be missed. And so it's, in the end, it's a clinical assessment. There is one other test that can help, and this is a urine test. And the urine test looks at the metabolites. So the microbiota are living organisms. They do things like they breathe, they produce energy, they eat, they poop, they pee. And in the process, they produce metabolites. And these metabolites can get into the body. And some of them have a beneficial effect. And some of these at high levels may have an adverse effect, for example, promoting inflammation. And we can measure certain levels of these metabolites in the urine, and these can be done through tests such as the OATS test or the MAPS test. But again, these tests are very limited, and we have to be mindful of that. They look at maybe 5, 10 metabolites in totality. But there's a human microbiome project that's being conducted now that's really trying to look at all the metabolites and what the levels should be. And it's a big undertaking. There are a huge number, a vast number of metabolites that we haven't yet identified, and we don't know what the healthy range is. So yes, there are tests that can be done. They're helpful, and they're helpful enough that I do them in most patients, but we need to be mindful that they're not perfect.
Okay, so next question. They're asking, can too many supplements be hard on the body? How do you know where to start with all these herbs, or which ones to give and how much?
That's a good question. So yes, too much of anything can be hard on the body, especially for a child who's having a hard time digesting, assimilating. So there are a few things. And again, in terms of where do you start, it depends on the child. But I may start with, for example, magnesium is a common one because it's so important. It's involved in 300 pathways. And if the child seems to have a hard time digesting, you can do magnesium oil. You can do Epsom salt baths. I also recommend always starting one thing at a time, waiting at least 3 to 4 days before you do the next thing, and not starting more than 4 or 5 things after a visit, to allow the body to adapt. Because remember, these children don't adapt well to change, and that could include the change of a new supplement. They're not very flexible in their nervous system response. So we're mindful of that when we're adding on things and layering it on. And then we just need to look clinically. How does the child respond? Are we adding supplements so they're getting worse or they're not getting better? Have they responded but they still have symptoms? Well, they may need more. If it's a child who seems to have a lot of problem digesting food, maybe we need to use creams like an antioxidant cream, a magnesium cream, or steer away from supplements. There are a lot of other treatments that I didn't mention here that seem to help that aren't supplements. For example, negative ions seem to help, and heat, and infrared heat. So there are treatments that use that, which some of my patients tell me is very calming. And these may be patients who really can't take supplements, including adults who they can't stomach the supplements. So they use a heat source that has the infrared and the negative ions in it. They tell me it's the one thing that gets their nervous system to be calm. So I don't have a protocol or an exact answer for this is how many supplements or this is what you start with, but these are things that you need to be mindful with. Start slowly, start one thing, and just monitor.
This person's asking, to my knowledge, our area has no holistic practitioners who specialize in autism. We have discrete doctors and psychologists who only focus on their particular area. How would you recommend working in that kind of system, or is there a way to influence a practitioner to consider a broader treatment?
That's a great question, and one that I struggle with myself, and I think many of the people involved in the ARI community do, because we know that there are many children out there who need access to these types of treatments and who would benefit, but there are not enough practitioners who are yet aware of these treatment modalities. So how do you address them and approach them? And I don't have a simple answer, but if you're working with a practitioner who seems open-minded, for suggesting that they try to become educated. So something as simple as this video is going to be available for free on YouTube after this. The ARI has many, many other webinars that are available, so listening to those if they are interested and they have the time. There are other conferences if they're interested in going deeper, including the MAPS conference. That's, I think, twice a year. And I know I've had practitioners who are interested who've called me, and I've spoken to them and helped them get started. So I think a good place to start is just making them aware of the webinars on the ARI and hopefully causing them to be interested in getting further education.
Okay, this is a parent asking, our 8-year-old has FASD and PANDAS.
Okay.
I've started down the path of nutritional support, vitamins and mineral supplementation, and going gluten-free. What do you think about dietary intervention?
So diet is critical, and I probably did not speak enough about diet just because there's so many things to talk about. But there is evidence that gluten can induce autoimmunity in some children, and PANDAS and PANS are thought to be autoimmune illnesses. So going gluten-free, I think, is an excellent choice, and seeing how the child responds. There are also certain diets that can promote or reduce inflammation. So one of the things that we mentioned in this talk is reducing omega-3s. So omega-3s can reducing omega-3s in the diet can reduce inflammation, and that's overall. So for a particular child, you can do, you can measure levels of omega-6 and 3 and make sure that's the issue. Sugars, excess sugars in the diet can also promote inflammation. So looking at that. And then there are high antioxidant foods. So these are foods that tend to be really colorful. They can also reduce inflammation. And then I've also found that in some children with the PANS or PANDAS, the infection, and I'm using infection in the loosest sense because it's not truly infection, but the issue that's driving this autoimmune process may be a microbiota disruption. So changing the diet, we know changing the diet can affect the microbiota, sometimes leads to dramatic changes. So I think nutritional approaches can't be underestimated. So,
okay.
Next question.
Yeah, we'll do a couple more here. We've got so many, I'm kind of looking through them.
Okay, sorry.
Yeah, a parent's asking this, and I don't know if you can answer this, but
Okay.
they're trying to wean their child off of SSRIs, and they're wondering about supplementation during that process. If there are guidelines that physicians might follow, or if there are recommendations out there.
There are no guidelines that I know of for supplementation. There are a couple of issues. One is when you're on the SSRIs, there are a couple of things you need to be careful of, and those are things that increase serotonin. Because remember, the SSRIs increase serotonin in that synapse. So if you give 5-HTP or L-tryptophan, then you may get something called serotonin syndrome. In reality, it's rare. I don't think I've ever seen a case of it, but you have to be very mindful of that and use those only with caution, and I would only use those if you're being supervised. For the other supplements, there's really no protocol. The best is to, again, find out what are the issues for the child. What are they deficient in? What imbalances do they have? And I believe if you figure that out, then you're less likely to have the withdrawal and you're less likely to have relapse. So I don't know if this child benefited from the medication, but one concern always is if they benefited from the medication and you take them off, are they going to be back where they were? So if you see the SSRI medication as a temporary Band-Aid and you allow the body to heal by doing these other things, it's probable that you'll be able to get them off and keep them off.
Okay, one last question. I work with a lot of clients with autism, and a majority of them have a very limited diet and are picky eaters. Is this limited diet enough to affect anxiety due to lack of nutrition?
So could the limited diet affect anxiety? It may be contributing because diet is so linked with the microbiota. It's linked with the mitochondria. It can also lead to other deficiencies. So if you're not getting a really rich diet, you're more prone to deficiencies in omega-3s and zinc and magnesium. And what happens is then, let's say you have a diet where you're low in zinc, these children then often are picky eaters and they further deplete themselves. So one thing that I do whenever I have a child especially the children who are really picky, is I look to see if they have zinc deficiency. And sometimes just getting the zinc levels can help. And then they start eating more, but then they're still stuck in the picky eating mode because it's become a behavioral habit. And then often feeding therapies help, and a combination of supplementation, getting their zinc levels up, and the feeding therapies can help dramatically in some children.